Earlier, we told you about a first of its kind cannabis conference in New Orleans aimed at creating equity in the business. And joining me now from the Black Canna Conference is philanthropist, actor, and advocate Malik Yoba. Welcome to BNC, Malik. Hey, first I got to give you props for being an actor. You've been in the game for so many years. You're still on top. Now you're in cannabis. This is pretty amazing.
Yeah, no, I feel grateful. I think we have an exciting opportunity as a country and as a community, specifically as Black and Brown folks, specifically New York. So although I'm in the conference here in New Orleans, and I'm meeting all kinds of amazing folks, farmers from Louisiana, Mississippi, Oklahoma, people, nurses, people with amazing testimonies on how cannabis has helped them overcome illnesses and that kind of thing. But I'm excited specifically. I live in New York. I'm involved in the business in New York, not just from the business side, but also the advocacy side, but more importantly, the education side. Because I think that there's still a stigma. People are confused. They automatically think cannabis means a bunch of people smoking weed, and it doesn't. There's a whole universe and ecosystem of opportunity from the legal side, from marketing to healthcare, wellness, and all of the sort of tributaries that make wellness possible. Cultivation, dispensaries is part of it. The real estate is a huge part of it, which is a big piece that I'm involved in as well. I also do real estate development. I have my company, Yoba Development. And we are committed to helping to educate the public. The stories have to be told too. So I'm excited.
Malik, I'm glad to hear you talking about the business side of it, the educational side of it, the wellness side of it. But listen, at the end of the day, people want to know, Malik, do you use marijuana?
It's called cannabis, and I do, absolutely. So when you talk about the health and wellness side, I had heart surgery a few months ago. So I never, and before that, obviously, we all experienced COVID and quarantine. I was having a lot of trouble with sleep. So for me, gummies have been the thing. CBD gummies have been the thing that have really helped. Like I noticed you have a graphic up right now that's showing the smoke. And again, that's the most obvious entry point for a lot of people. But there are many medicinal benefits. And for me, sleep and pain management post my surgery has been critical.
Well, I didn't know about your surgery, so I'm glad you're doing so much better.
One of the first things they do, no, I just want to say this. When you're in the hospital, and I had quadruple bypass, by the way. That's a whole other conversation.
Wow.
Yeah, and I just need to say, so for those that are listening or watching, if there's a genetic predisposition in your family around heart disease, please make sure you are getting your scans done, not just blood tests, and the blood tests that you need to get look specifically for lipoprotein little a and C-reactive protein. You can walk around like someone like myself, fit, eat well, exercise the whole bit, and still have blockage and not know it. So that's that. But recovering from that, being able to use cannabis products, primarily there's some balms that I use for the scar, for that are mixed with like shea butter and some other ingredients, but also for the pain management. So they ask you on a scale of, I think they go 1 to 5, whatever, what's your pain level? Well, if you never had heart surgery before, it's hard to imagine how do you like quantify that. And they go, so what do you want? Either, what's the main opioid? Oxycontin or Dilaudid. And the first thing they're going to do is give you an opioid. And I didn't want that. And so I was literally in the hospital and I had gummies, and my doctor looked at me, he's like, what's wrong with you? I said, bro, this is how I need to sleep. This helps me sleep. This helps me with my pain. So that's my testimony, and I'm sticking to it.
Malik, that is wild. You've got a wild story. I mean, that's amazing. But you know, people are scared about the legalities of it. Let's face it, the history of weed and cannabis is that you go to jail for that.
Right. Well, you know, in New York, and this is what is exciting about where the country is moving. Remember, alcohol used to be prohibited. So let's talk about that. This is like 1920 America, right? 1920s, right after the, you know, Great Depression. They had to figure out how are we going to drive this economy. America is in the same position. New York specifically, from those that have been just as involved, New York is setting aside hundreds of licenses for people who are directly impacted by drug laws. Folks who have done time for cannabis are now given an opportunity in front row to be able to participate on the upside. That's huge. A lot of the taxes that are going to come from cannabis are going to be used for educational programs, training around real estate, you know, development, um, all the different aspects of the business. So this is the intention of the state of New York. How it's executed is yet to be seen, but I know that we have a bunch of black and brown people who are part of the Office of Cannabis Management, also on the board, that are really intentional about what they want to see happen for our people. So when I think about the legal side, I think about how laws that are made by humans do change, are changing, and and that's what I think we need to focus on. If you're in a state where it's not legal yet, then continue to educate yourself, continue to find ways you can advocate for it to become legal, but get involved. Just don't sit on the outside and think that it's going to be just all bad news for you, because that's not the case anymore.